All right, welcome back. The CDC launching its Emergency Operations Center. Now, this is all in response to the vaping crisis we're seeing across the country after now the 7th person has died from this mysterious vaping illness. Now, here to tell us more about all this is Dr. Jason Sevald, the medical director of the ER for Palm Beach Gardens Medical Center. Doctor, thank you so much for being here. Shed a little light on this mysterious illness that we're seeing all across the country. It doesn't seem to have any geographic center or anything like that, but we are starting to see some sort of link when it comes to this illness. Tell us about it.
So it is associated with the vaping. That's the one association they've been able to consistently make across these cases. And that's the reason the CDC is opening this program, is so that they can do more research into it and start to figure out what is the exact mechanism. Is it a chemical reaction? Is it a interference with the natural chemicals in the lungs? What is actually going on that's triggering these illnesses in these cases?
Have you seen any of these cases in your ER?
I have not had any cases myself that I'm aware of yet, although of course, like any sort of illness, there's probably a spectrum where some are very mild and some much more severe. So some of what I've thought have been cough and colds and regular respiratory illness stuff, and people who happen to be vaping could have been.
Now tell me, when you get teenagers in your ER, even young adults, do they admit to vaping? Is it something they talk about, or is it still considered somewhat hush-hush?
I wouldn't say it's hush-hush. I do think we need to do a much better job now about aggressively asking about it and being proactive in that way.
Because for so long you've been used to talking about tobacco use, whether it's chew products or cigarettes, but to add vaping to it, it's not necessarily part of those questions that you get asked at the doctor just yet, because it's also new.
And it should be now, and it really needs to be.
And so what is the main concern? As a medical expert, what is the reaction that is happening in these gadgets that has you so concerned? So we know, of course, the nicotine and the reaction that came with cigarettes for decades we've all been warned about, but what is it about these new things?
Well, and that's what we really don't know yet. That's why the CDC has opened this program to get more research going at an accelerated pace to figure out exactly what is the cause. They have not been able to tell us that yet, and that's the very reason they need this program open.
So what would be your advice if a parent came to you and said, hey, I think I found my child vaping? What would be your advice to them?
I mean, they need to have an honest discussion with them, talking about the dangers, explaining these large number of respiratory illnesses, including 6, now you said 7 deaths, and not only the long-term effects of hypertension, heart disease, but these immediate short-term illnesses that they can suffer.
And isn't the bottom line, I mean, there's been a lot of information put out there over the years, some of it misinformation, that this is sort of a way to get off traditional cigarettes. What would be your response to that?
That the best way to get off traditional cigarettes is to use a program, use the actual prescribed aids, such as the gums or the patches, or the methods that have been investigated and truly shown to be used for that purpose.
Because the bottom line is, if something is being ingested in your body in any form,
it's still bad for you. Correct. It isn't. Yeah.
It's good to investigate what exactly is inside it, and that's what the CDC is doing this week. Can you think of any other time that we've had sort of a mysterious kind of outbreak like this, or does this feel somewhat new?
It really feels new. It does.
We'll have to see what happens then.
Yes, of course, I'm sure the CDC, obviously it's at the forefront of their minds right now, and they're putting all their resources to it. So I'm confident that they'll get us some answers.
And that's the big headline this week. The CDC officially kicking off their Emergency Operations Center to figure out what's the bottom of all this mysterious illness going around. All right, Dr. Jason Sevald, thank you so much for being here this morning. We put a whole bunch more information on this current outbreak and e-cigarette products, vaping products, all that information you're going to need to talk to your kids about this over on our website, WPBF.com. You can also go to cdc.gov/e-cigarettes to learn the facts about vaping. Doctor, thanks for being here. Let's toss over